The member for Bowman, in continuation.
The mountain is climbed. You're at the top, Mr Roy. Enjoy the sunshine. To the many people who would have said why it shouldn't happen, why it couldn't happen, why it was unlikely to happen, one man who happens to be young set about proving why it would happen. And it did. You are freed in order to be bound again in public service, but let's also remember that anything that can happen once can surely happen a second time, although it may not be for a very, very long time. Deputy Speaker, this is not about safety and quality in healthcare. As I've already explained, this is about another enormous statutory authority which further represents a slew of bureaucratic legislation coming from this Labor government. There were fast-moving, streamlined safety and quality boards and commissions before. We didn't need a multi-million-dollar solution to further slow down the work of this place. But this is not a single piece of legislation on its own, Deputy Speaker. We see other pieces of legislation introducing even more statutory authorities into healthcare in this country, while the conditions in remote and rural Australia continue to decline. We know the words of closing the gap, but the one single intervention, the Northern Territory emergency intervention, has been utterly ignored, and the back has been turned by this government on outcomes since 2007 and the election of the Rudd government. Because while their lips move and suggest that the intervention is supported, the safety of children and the quality of health care continues to struggle for the simple reason that there is no commitment to improving this intervention. And last week, the Bath report delivered to the Territory government found not a single element of personal responsibility involved in the disgraceful area of child abuse, but instead they set about making 147 bureaucratic recommendations to the Territory government. No wonder that jurisdiction has lost its way. The recommendations from the Bath inquiry suggested that we needed more process, framework, agencies, peak bodies, principles, consultation, planning processes, preventions, complaint processes, education strategies, more advisors, planning units, more KPIs, workforce, mediation, more outsourcing, clarity, administration, more training, more data collection, partnerships, more frameworks to be adopted, more skills to be evaluated, more consulting, more initiatives, more strategies and, yes, more guidelines. You'd think that this Bath inquiry actually only came to an end when they ran out of bureaucratic nouns. They got to 147 of them. But was there a single mention of personal responsibility? Was there a single mention that parenting is something that needs to be the first and foremost role of every parent? And in this Northern Territory intervention, where for the first time in Indigenous history a systematic move was made against alcohol abuse for the sake of the children, towards school attendance for the sake of the children, towards health checks for the sake of the children, we've seen not a single modification or reform being made. And what do we know as a result? From 2008 to 2009, the enrolments at school have declined. The attendance at school has declined. The reporting of both domestic violence and alcohol-related infringements has fallen away. What we are seeing is no improvements. The lips are moving, but the warmth of the embrace is not there, Deputy Speaker, for that intervention. And with it goes the future, an entire generation of children who are seeking safety and quality in their health care. Now, another report passed my desk this week, Mr Speaker, was the better hospital care for Aboriginal Torres Strait Islanders after experiencing a heart attack. Again, 3 years now, the time is ticking, but no improvement in Indigenous liaison, no improvement in cultural familiarity for staff, no improvement in introducing Indigenous people to governance of our hospitals, no improvement in making mainstream services better for Indigenous people. We have a 20 times rate of early discharge by Indigenous Australians who check out and walk out of the best health care in the world for the simple reason that it is not one for which they are familiar, not one for which they are introduced to and able to feel safe and comfortable and culturally safe. That is a priority of the National Heart Foundation. It must be a priority of this government. It shouldn't sit for weeks and months without response. It is at the essence of safety and quality. It's one thing, Deputy Speaker, to be talking about getting the drugs wrong or the infusion wrong or adverse reactions in first world health that we all enjoy, but quite another when you look through the reams and reams of bureaucratic legislation we are faced with on this side of the House. As I said, the The lips are moving, but nothing's changing in remote, regional and Indigenous Australia.